Urta Punjab has been in the news for censorship issues. But let's put that aside for a second. It actually covers a very important and a less appreciated problem: addiction.
Millions all over the world are affected by this condition, and now addiction is actually recognized as a disease of the brain.
Now, addiction not only affects the person, but also the family and friends. Basically, the first circle of people around them. And the most common question is, why does addiction happen?
So today, let us try and decode why does addiction happen? What happens in the brain when you take these drugs? And what factors might drive people to addiction? I am Dr. Sonia Lal Gupta.
And I'm Dr. Sameer Gupta. And welcome to Doctors on Call. The word addiction itself comes from the Roman word meaning enslaved or bound to. Addiction by any object, whether drugs, alcohol, nicotine, or even behaviors, hijack the brain, affecting your body and creating havoc in it. Brain chemistry plays a major part in addiction. Our brain likes things that make us feel happy. It could be alcohol, something we like to eat like chocolates, sugar, cold drinks, cigarettes, anything, no matter what it is. It all happens through the brain's reward-seeking pathway. To learn more about addiction, we spoke to Doctor Atul Ambekar, faculty at the National Drug Dependency Treatment Center at the All India Institute of Medical Sciences in Delhi.
Many people tend to view addiction as an illness like typhoid or malaria. You just give someone a few days to few weeks treatment and the person will be totally alright. That is not the case. Addiction is a disease which is similar to diabetes or high blood pressure. Just like for those diseases, you need to take treatment for a very long-term basis. In some cases, perhaps lifelong. Similarly, for addiction also, you require treatment for a very long duration of time.
Deep in the brain, we have an area called the ventral tegmental area. This area releases a chemical which is a feel-good chemical called dopamine. This chemical travels higher to another area in the brain called the nucleus accumbens. The nucleus accumbens deals with emotions and motivations. Dopamine stimulates this area, making us happy and wants us to have the same feeling of happiness again and again. When we take something like cocaine, it causes the dopamine levels to go up by up to 10 times, causing a high feeling of euphoria. When done repeatedly, it starts changing the brain, causing the brain to adapt to these levels and in response produce less dopamine, either by reducing the dopamine producing cells or by making them less sensitive. This causes the person to take even higher amounts of the drug to get the same pleasurable feeling.
Drug abuse and addiction can have long-lasting effects on a person's health. Now, everyone is prone to addiction, but some people are just more prone than others.
Just like any other medical disease, addiction is also multifactorial in nature, which means a wide variety of factors interact with each other to develop the problem of addiction in someone. One very important and often overlooked factor is genetic factors. There may be environmental factors also. For instance, the peer influence, easy availability of drugs in your neighborhood, that is another factor. Difficult childhood, problems in upbringing, dysfunctional family environments, all of these factors which may make a young person get attracted towards drugs, try those drugs and finally become dependent on those drugs.
During our conversation, Dr. Ambekar continued to express the importance of support of the family for helping people recover.
If you think one of your family members has a problem of addiction, first of all, don't shun away that individual. Try to see him as someone who needs help. It's understandable that many people who suffer from dependence engage in such behaviors which are obviously not liked by their family members. That is also a part of illness. Let's understand them. That people who are suffering from addiction, they deserve our compassion, our empathy, and most of all, our care and support.
Social support from friends and family plays an extremely important role as an addict recovers. And it's centers like these that are actually offering the medical help that someone needs on their road to recovery.
Now people need to keep in mind that addiction is a disease and it is not just a condition. It can affect people all over the country from every socio-economic strata. Also, please remember, as Dr. Ambekar said, that addiction requires a long-term treatment plan and not just short-term plans to make sure that these individuals keep functioning in the society.
So let's all decide to hold hands together and give these people the support they need.
See you next week.